Thanks for watching Conversation with Dr. Allen. Today we have some difficult but horrible news to tell you about a young lady who continued to work knowing she was positive for the coronavirus. This young lady presented to us back in March of this year when the pandemic started, and she was known to have a detected critical value where she was positive for the coronavirus in the beginning when the surge of the virus started. She then became sick in June, like 3 months later. At that point, she went through the drive-through device or check-in station, of which she was tested positive around July the 1st. The drive-through program emailed her the positive results. She continued to work from July the 1st until July the 15th. Now, mind you, she knew when we tested her back in the beginning in March, there was a 14-day quarantine. And this paper she had given to her job at that time. After 14 days, she then went back through the drive-through to see if she was negative. She tested positive again at the drive-through, of which now she felt obligated to let her job know. Keep in mind, she had been working for 14 days in a row, and I understand that she could not afford this time to quarantine and not get paid, and so she kept her mouth closed and continued to work, disregarding how this would affect other people. Now, when it came to our attention, her job remembered us from her original positive test, and they called us to come and test everybody at the job site. She worked at a boarding care home, 13 people, and there are quite a few disabled residents. Of the 13 people, she got 1, 2, 3 of her co-workers ill, and remember, they have families as well. She also got 1, 2, 3, 4 of the elderly people at the boarding care home who was disabled, sick. Now, this doesn't let you know you cannot trust individuals of which you're sitting by, walking by the beach, in the grocery store, because there is no quarantine police. There are people who probably are positive and did not tell you. Now, this situation has been handled. The patient, the young lady has lost her job, and public health is making sure that the individuals here are being taken care of. And the way we found out was the job actually called us out to do the testing. But my reason for bringing this to you is that this should really tell you why you should be wearing a mask at all times. Do not trust anyone, even family members. They may not let you know if they're positive. They may not respect the virus as positive. They may actually think, as some people say, it's just a flu. But nevertheless, the infectious rate is extremely high. And if they're not taking care of themselves and concerned about their family members, you should. Remember, we're all in this together. Be safe and take care of yourself. Now, I could keep my mouth closed, or I could have these conversations. Thanks for watching Conversation with Dr. Allen.